for the thyroid and hypothyroidism, I think this is kind of fun too. I kind of enjoy the endocrine disorders. So the three hormones produced by the thyroid gland include T4, T3, and calcitonin. And if somebody has a euthyroid, that means everything is functioning properly. Now I want to show you this picture. This is a simple goiter, and this happens usually due to lack of iodine in the diet. So that's why, like, years ago we started putting iodine into salt to prevent people from getting a goiter. Now the goiter, this is the first symptom of a simple goiter, is going to be enlargement of the thyroid gland. Now this is kind of confusing to students. The goiter can cause hypo or hyperthyroidism, and it also can they can just have a goiter and have like no signs and symptoms associated with it. The nutrient that prevents goiter is iodine. I talked about that, and it's put in. Can it cure it? No, but it can halt its growth. So if somebody isn't on a diet with iodine in it, they can be put on it to kind of halt that growth. All right, and seafood is a good source of that. So a patient with a simple goiter may develop a toxic goiter if it's exposed to contrast medium. And that is going to be a central theme. People with thyroid problems, you have to be careful if they're exposed to contrast medium. It can put them into a thyroid storm, which I'll talk about later. So a patient that does have goiter due to a lack of thyroidism hormone or low hypothyroidism is going to be given levothyroxine. And then once somebody's on levothyroxine, you're going to look for adverse effects, and they're going to be the same as hyperthyroidism. Okay, so the adverse effects of iodine. Look for a metallic, or sometimes it's described as a brassy taste. That's what one of the side effects are: rashes and GI upsets. They need to be, iodine preparations need to be diluted and delivered through a straw, because it could cause teeth staining. Hyperthyroidism occurs due to excessive thyroid hormones. Graves' disease is just hyperthyroidism that is caused by an autoimmune disorder. Now, hyperthyroidism is a disease that can present with cardiac problems. Like one of the presidents, President Bush, and I think it was the junior Bush, he presented to the ED with like AFib, and it turns out he had Graves' disease. So they can present like they're having a cardiac issue with hyperthyroidism. Okay, now the signs and symptoms of hypothyroidism you can remember with the mnemonic sweating. And you just have to remember the metabolism is really revved up in hyperthyroidism. So S stands for sweating. W stands for weight loss, so they're going to lose weight. E stands for emotional lability. That means their emotions are all over the place. And think about it, like if you're super stressed, like you're in nursing school, right? You can cry one minute, be laughing the next. It's just common. Exophthalmos. This is when they have the eyes that pop out, and that's common in Graves' disease. Appetite is going to be increased, and they'll have amenorrhea for A. T stands for tremor and tachycardia. Remember, everything is revved up, and when you're revved up and stressed, you're like can have tremors and be shaky, right? Intolerance to heat. Now, this turns me around, because I always think because they lose weight, they're going to want to be, they'll be cold, but no, their metabolism is so revved up that they can't stand being in hot places. Okay, because it's not just simply they've lost weight, they're losing weight because their metabolism is revved up. So you have to remember intolerance to heat and insomnia because they're revved up, right? N stands for nervousness and tremors because they're revved up. And G stands for GI problems, okay? So older adults present a little bit differently, and they can have those signs of dysrhythmia such as shortness of breath and palpitations. So a TSH level, this is a thyroid stimulating hormone level. And if it determines if the thyroid gland is overactive, underactive, or just right. So their T4 and T3 will be increased in hyperthyroidism. And then again, so an EKG is going to be done in patients with hyperthyroidism because it often presents as a cardiac disease. So just remember that. They can present with all kinds of dysrhythmias. So somebody having a thyroid scan, you need to make sure they're not pregnant and make sure that find out if they're taking iodine medication, and see if they've recently taken iodine. Now, your nursing interventions for somebody with hyperthyroidism is all revved up. You want to keep their environment calm and provide rest and make sure they're getting rest. Administer sedatives. Keep the room cool and quiet. Daily weights and INO, they're going to need a high calorie diet, no caffeine and other stimulants, and administer antithyroid medication and beta blockers. Okay, anybody with hyperthyroidism that has a temperature that increases greater than 1 degree you have to report that. You have to watch out for that because that could indicate a pending thyroid crisis. We also call that thyroid storm. So that's really important. So the treatment for hyperthyroidism could be a thyroidectomy, but it also could be radioactive iodine therapy, which is also called ablation therapy. So radioactive iodine therapy, it's called iodine 131, is given orally. And ATI says there's no special radiation precautions if the patient is undergoing iodine 131 therapy. However, your book says something different, so I'm going to stay away from that question. But I think if you get it on your proctor, you're going to go with what ATI says, and it says you should stay 1 meter away from pregnant women and children. Okay. Symptoms of radiation sickness from taking the radioactive iodine is bone marrow suppression. So just like other forms of radiation, okay, and hypothyroidism, because if the treatment works, they will wipe out the function of the thyroid gland. Internal radiation is brachytherapy. So if somebody's going to have a thyroidectomy, the surgeon actually will order them to have iodine products pre-surgery. And this is to reduce the size of the thyroid gland so that they can dissect it better, because the thyroid is highly vascular. So they need to like shrink it. It makes it easier for them. And then one of the adverse effects to look out for is that brassy metallic taste in the mouth if they're on iodine. Okay. And then post-thyroidectomy, this is something I like taking care of these patients when I worked in the PACU. Now, because of the location of the thyroid, you always have to be thinking about the airway. Okay. So you're going to watch that closely and watch for swelling of the neck. Your patient needs to be in either high fowlers or semi-fowlers. So get the head of the bed up, position and support the neck and head, and make sure the head and neck are in neutral position. You need to avoid neck extension because they just had surgery on their neck. That's going to be painful. Monitor the front of the neck and the posterior of the neck. You want to look for bleeding. So let me explain this to you. So your patient comes out, they're in high fowlers, you got, the head and neck are neutral. The dressing is going to be on the front of the neck. But what can happen, you may not notice, is they could be bleeding and that blood can be dripping around to the back of their neck. So that's why you always have to feel under, and we wear gloves now, so you might not see that, but you might roll them over to check the back of the neck to make sure they're not bleeding. If anybody says to you, this dressing feels tight, or I'm having trouble breathing, make sure you're checking for hematomas, okay? Because that is a medical emergency. Of course, they're going to have pain, and you're going to give opioids to treat that pain. You need to assess the patient's voice every 2 hours at least. So when my patients came out, I always said, hey, tell me your name. And so I would assess their voice because you want to make sure they don't have any nerve damage to their vocal cords. but discourage them from talking. You expect the voice to be hoarse, but you also expect them to be able to talk to you even though the voice is hoarse. Okay, you do expect a moderate amount of serosanguinous fluid and monitor for hypocalcemia. The reason you monitor for hypocalcemia is because the parathyroid glands, they regulate calcium and phosphorus. Well, they're really tiny, and the surgeon is probably going to inadvertently take them out when they're doing a thyroidectomy. That's a known thing, okay? They will have JP dressings usually when they come out of surgery. So these are your symptoms that indicate bleeding: restlessness, tachycardia, complaints of a tight dressing, or a wet posterior neck. Extremely important you know that. Now, anybody that has thyroid problems and has stress or has like surgery, they're going to be at risk for thyroid storm, and you need to know the signs and symptoms of thyroid storm. So, because it's life threatening. That's the increased temperature I talked about earlier. They're going to have cardiac problems, hypertension. So you need to be on it. Okay. Um, the electrolyte imbalance you're going to look for is hypocalcemia. Now make sure you're doing that Quizlet about hypo and hypercalcemia to know what the signs and symptoms are. Okay, so say they take out the parathyroid during a thyroidectomy inadvertently. There's 4 little glands. Say they take out half of it, like 2 glands. They can still have symptoms of hypoparathyroidism. So to make it easy, put hypoparathyroidism in the same category as hypoglycemia. Okay, so they'll have hypoglycemia and a high phosphorus, because calcium and phosphorus are the 2 electrolyte values you have to follow with somebody that has hypoparathyroidism. So the signs and symptoms of hypocalcemia is CATS: convulsions, Chavaste signs, the arrhythmias, tetany, tingling around the mouth, and Trousseau sign. Look for stridor and muscle spasms. So stridor is deadly. So you have to be able to recognize that. Remember what Trousseau sign is. Review Chavaste signs. When my patients came out of the PACU, one of the first things I do is I would tap their face near their ear, right on the facial nerve, to make sure they didn't have a positive Chavaste. Okay? So if they do, they get calcium gluconate. A client with hypopar or thyroid will have signs and symptoms of low calcium and hypocalcemia, which is the same thing. I don't know why I wrote it twice. So make sure you know what you're supposed to look for. Okay, this is important. You want to keep emergency intubation equipment nearby, okay? You also need, anybody that's had a thyroidectomy, you keep a trach tray. It follows them. So I would have it in the PACU, and I would put it on the bed when I transferred them to their room. They have to have a trach tray in their room at all times, because if they do get a hematoma, or they stop breathing, or their calcium is really low and they have stridor, they're going to need an emergency bedside tracheostomy. Okay, so make sure you understand that. Okay, what causes thyroid storm? Stress. All these things. Test with contrast medium containing iodine, pregnancy, infection, trauma, and surgery. So you have to be on the lookout. So here are your signs and symptoms: high temp, high heart rate, high BP, high respiratory rate. Like everything is revved up. They could have chest pain due to cardiac incidences, but they could die. So we have to be careful of that. So the treatment is they're going to go to the ICU. You need to get that temp down, so give acetaminophen. They're going to get cardiac meds and also sedatives. All right, I told you about the trach tray and suction. Not having your suction set up and working is like a big pet peeve of mine. You have to be ready for emergencies. Everybody that has had a thyroidectomy needs to have a patent IV. Okay, your patients need patent IVs, because you don't want to have an emergency and have to insert an IV. during an emergency, especially as a new grad, because you're not going to be good at certain IVs. I'm just telling you the truth. So you always want to make sure your IVs are patent at the beginning of your shift. All right, so if somebody has parathyroid problems, we're looking at the calcium and the phosphorus. So a patient with hyperparathyroidism is going to have a high calcium and low phosphorus. So make sure you know the difference. The signs and symptoms of hypercalcemia, you can remember bones, stones, groans, thrones, and psychiatric overtones. Okay, so with bones, their bones can be brittle. That can happen also with hypocalcemia. Stones, they're going to be prone to kidney stones. Groans for constipation, because remember, calcium is like a sedative to the body, so it's going to slow down the bowels. Thrones, they're going to have increased urinary output. Psychiatric overtones, because calcium is like a sedative, they're going to be lethargic, apathetic, and have depression. All right, so hyperparathyroidism, look for signs and symptoms of high calcium. A thyroid stimulating hormone level evaluates if the thyroid is overproducing, underproducing, or just working like it should. So remember the people that you need to collaborate with if somebody has hyperthyroidism, the radiologist, because they're probably going to get the I-131, the dietitian, because they're going to need increased calories, endocrinologist, because they treat endocrine diseases, and the pharmacist, because of the medications. Now let's switch over to hypothyroidism. So this is an underactive thyroid gland. So the risk factors, it could be an autoimmune disease that's called Hashimoto's. Could also mean somebody had hyperthyroidism, was treated with iodine therapy, radioactive iodine therapy, and now they have hypothyroidism. So remember the signs and symptoms, but from the mnemonic "Mom so tired," so it's opposite of hyperthyroidism. So they could suffer memory loss and myxedema. Myxedema is a medical emergency, and I'm going to talk about that a little later, but it's kind of the extreme that happens in hypothyroidism. O is obesity despite having anorexia. Okay, so they don't feel like eating, but yet their metabolism is so low they gain weight. M is for malar flush, metabolism slow. S is for slowness, both mentally and physically. So they'll have a slow heart rate, slow bowel, slow thought and speech. S stands for skin and hair dryness. So they're going to be dry. O stands for the onset is gradual. T stands for tiredness, lethargic, thinning eyebrows. So people with low thyroid hormones, they get what's called a Queen Anne eyebrow. And so like the last 1/3 of their eyebrow is missing. And it's funny because like I talk to people and I'm like, oh, I wonder if they have hypothyroidism because I noticed the Queen Anne eyebrow. Okay. I is for intolerance to cold and irritability. So remember, even though they're obese, their metabolism is slow, so they can't stand being cold. Really low blood pressure. E, energy levels fall, and D is for depression. Okay, so you're going to expect the T3 and 4 to be low. And what interventions for a patient with hypothyroidism? They're going to be tired to promote rest by spacing their activities, protect against the cold, monitor their temperature, increase fluids, orient PRN, no electric blankets or heating pads because it can cause burns because they can't feel, and monitor for edema. Avoid fiber laxatives, calcium, and iron when you're giving the levothyroxine because that's levothyroxine needs to be given on an empty stomach so it can be absorbed in the morning separate from other medications. Okay, levothyroxine is going to increase the metabolic rate, so you should monitor for signs and symptoms of hyperthyroidism once somebody is taking levothyroxine. And a dose too high is going to cause the symptoms of hyperthyroidism. So myxedema coma. So this is like a medical emergency for somebody with hypothyroidism, and it's triggered by stress, infection, drugs, exposure to cold, and trauma. So the signs and symptoms, you have to recognize this. It's going to be below normal temperature, so hypothermia, decreased breathing, hypoventilation. So airway of breathing are going to be issues. low blood pressure, hypotension, low blood sugar, hypoglycemia, and unresponsiveness. So your main goal is to maintain that patent airway. Start aspirations precautions. Don't use electric heat to warm them up. Investigate if they have some kind of infection like a UTI, something stressed them enough to get them into a myxedema coma. Do the daily weights, I's and O's. And a symptom of hyperthyroidism, just switching gears here, is a heart rate greater than 80 while sleeping. Okay. And for Hashimoto's, that's just the autoimmune disease that can happen, but it's going to be the same signs and symptoms, same treatment for somebody with hypothyroidism. Okay, that's it. Study hard, and I want to see good grades on your exam too.